Thanks again for joining us for today's St. Louis Metropolitan Pandemic Task Force briefing with Dr. Alex Garza. The briefing will begin in a moment. After Dr. Garza's opening remarks, he will address questions that have been submitted by members of the media. Reporters who have questions during the briefing can submit those to the Task Force Public Information contacts. We will address those during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, thank you, and good afternoon again, everybody. Before we get started, I wanted to acknowledge and thank the community for all that you have done to support healthcare workers. I've noticed all of the street lights and many of the building lights in downtown St. Louis are lit blue, and that's not recognizing the hockey team, that was recognizing our healthcare workers, and so very appreciative of that. There's also yard signs across the region, all supporting our healthcare workers dealing with the pandemic. And I know I speak for them by saying we're very grateful for your support. But mostly we're grateful for the so many people that have changed their behavior in support of those healthcare workers. Those behavior changes are the steps that are working, and those are the most impactful ways that you can help support healthcare workers, and that is by limiting the spread, limiting infections, limiting the number of patients that they have to take care of. So thank you all for that. As I mentioned yesterday, this is a time to keep the hammer down. The virus is still circulating in the community and is still causing hospitalizations. And it's easy to become frustrated and be tempted to gather in groups, especially as the weather is warming up. But it's really clear that we're reaching a critical time in the pandemic. And so I'm asking the community, don't let up now. Keep up what you're doing, stay at home, wash your hands, keep surfaces clean, and practice social distancing whenever you're around other people. So now let's get to our daily numbers. So here's the latest update on our data. Again, these data are the combined figures from the 4 major healthcare systems, SSM Health, BJC Health, Mercy, and St. Luke's. And these are all hospitals that are part of the task force. So as you can see here, the hospitalizations are up compared to yesterday from 634 to 702 today. The number of patients in our intensive care units is around the same. It was 189 yesterday, and today is 185. And the number of patients on ventilators is down. Yesterday we had 160 people on ventilators, and today there are 145. And also across our healthcare system hospitals, we had 50 COVID-19 patients that were discharged yesterday, so that is good news. Since we started these briefings a week ago, the inpatient COVID and patient under investigation numbers are still up significantly, so we're definitely still on the rising side of that curve. And now I'd be happy to address some of the questions that we've received from the media.
In both yesterday's briefing and today's, you have said we are still on the steep part of the COVID-19 curve. When we reach the apex, will we necessarily know it then? Or will we know we have indeed reached that peak only once cases start to decrease?
So it's a little bit of both. So our modeling has given us a range of when we think we're going to reach the apex. And so we know that we're still on the steep part of the curve. We have a reasonable approximation on when we think we're going to reach the peak. But really you don't know when that peak is until afterwards when you see a continual decline in the cases. So we'll keep an eye on that date range that we have right now. But you really don't know until after you see cases substantially and consistently decline over time.
What is the biggest and most immediate need for area hospitals and healthcare workers right now?
So healthcare is doing okay right now. So obviously we're still operating under crisis standards of care. We're still having challenges with personal protective equipment. And so that isn't to mean to say that we're going to run out tomorrow, but we're still operating under those crisis standards of care, which means we're doing things like doing extended use of some of the personal protective equipment and reusing some of it, things like that. And so we're still playing catch up with PPE, and so I think that's probably the biggest challenge that we're experiencing right now.
Reuters is reporting that hospitals around the United States have agreed to loan ventilators to hospitals. Do you know if any local hospital systems have agreed to take part in that program?
I have not heard of any of our local hospitals taking part in that program, and I think that stands to reason since we're still on that steep part of the curve. That we're a little bit conservative on ensuring that we have adequate capacity to take care of the patients in the St. Louis metropolitan area.
If we are indeed reaping the benefits of social distancing, is there a concern that we may relax orders too soon statewide? And is there a problem with having different orders for rural parts of Missouri versus urban parts of Missouri?
So there's always a risk of relaxing our social distancing and our shelter-in-place orders too soon. And we've seen this from other pandemics, even in the 1918 influenza pandemic in St. Louis, when shelter-in-place orders were relaxed too soon. And we did see a second wave in that 1918 pandemic. And so we know those are always possibilities. So we have to be very diligent and make sure that we're erring on the side of caution when we're relaxing a lot of those social distancing. So clearly it's much more coordinated if we're all on the same page on when we relax shelter-in-place orders. It makes it easier for us in the healthcare system. It makes it easier for us in public health. And it helps us tracking the disease as well. We know that we have a very fluid population, and so if people are traveling in and out of the metropolitan area, that does increase the probability for continued spread in the community. And so we would prefer, and when I say we, I'm talking about the healthcare sector, would prefer a much more coordinated and organized timing on relaxing those shelter-in-place and social distancing rules.
Dr. Garza, this reporter is wondering whether you can comment on what triggers the fluorescent, what will trigger the fluorescent alternative care site to open, and how close are we to seeing that happen?
The alternative care facility up in Florissant will be opening tomorrow morning. It is designed to take care of low acuity COVID patients. So this is nothing, won't be taking care of complicated patients there, but this is merely a means for people that are recovering from COVID, or people that don't have serious signs and symptoms if they need someplace to quarantine or just some minimal care, that they'd be able to go to this facility.
That concludes the questions that have been received today in advance of the briefing by the Task Force Public Information Team. If reporters have additional questions after the briefing, please feel free to submit those to the Task Force Public Information contacts, and we will respond to those as quickly as possible this afternoon. Otherwise, we will begin to collect questions tomorrow morning for tomorrow afternoon's live stream. Thank you for tuning in.